Okay, so in this video we're going to look at the types of fibrous joints. So in the last video we talked about how there are three structural classifications of joints. We had fibrous, cartilaginous, and synovial. And all of the fibrous joints are made of dense fibrous connective tissue. Now these types of joints don't have a cavity. Instead what happens is these bones are just tightly linked by this dense fibrous connective tissue. And if you guys remember, this is a type of connective tissue proper that's vascularized, but the reason why it's dense is that there's a lot of fibers here and they're so densely packed that it makes this type of tissue strong. And because this type of tissue is so strong, typically these fibrous joints are immovable or synarthrotic. However, that does depend on the length of these fibers. So if you have longer fibers, the joint is going to be slightly immovable, and if they're shorter fibers, it's going to be immovable or synarthrotic. So there's three types of fibrous joints. We have sutures, syndesmoses, and Gomphoses. So the sutures are these rigid interlocking joints of the skull, and they actually allow for some growth during youth. Now because these fibers that hold the cranial bones together are so short, it allows for the skull to kind of expand slowly, but also limits the movability of these cranial bones. And what's interesting too is that as we get older, these sutures ossify and fuse, and they're completely immovable at this point. And so at the point where there's not really many fibers left and the cranial bones are fused together, we call this a synostosis. So if you look at the structure of a sutural joint just very closely, remember it's a type of fibrous joint, and if you look here between the cranial bones, let's say at the juncture of like the sphenoid and the temporal bone or parietal bone, what you find then is that these are two separate cranial bones, and at the place where these bones meet, you find that they're very intimately and tightly linked by this type of fibrous joint, which is a suture. Now it's a dense fibrous tissue, and there's so many of these short fibers that these bones are going to be held together very strongly, and they're very stable. Now what's interesting is that as we get older, these types of fibrous joints start to disappear, and instead what we have is a synostosis, where it's just bone that's fused together. And that's one of the ways you actually can determine the age of someone's skull. So syndesmosis is actually where you have bones connected by ligaments, so they're longer fibers. And remember, technically a ligament is where you have basically dense, regular connective tissue that connects bone to bone, and they're longer fibers, so these ligaments can be slightly movable. Now the fiber length can vary and movement can vary, but shorter fibers are going to offer little to no movement. So like an example of this would be like the tibiofibular joint. There's very little movement there. But the longer fibers, areas where you have like long fibers, let's say in the interosseous membrane, like between your radius and your ulna, or between the tibia and fibula, this interosseous membrane, which connects the two bones longitudinally, or transversely rather, they're longer fibers, so they actually allow for a slight degree of movement of those bones. So for instance, when you rotate your forearm, like anterior and posteriorly, what happens is the radius actually rotates around the ulna, and there's some degree of movability in this interosseous membrane. So if you look at an example of a syndesmosis, we find that there's these connective tissue fibers here that would connect things like your tibia and fibula together. Now technically this is a ligament because it connects bone to bone, and therefore is also a syndesmosis. Because these fibers are a little shorter, it offers very little movement. So this is going to be somewhere between a synarthrosis and an amphiarthrosis in terms of movability. But you would also find an interosseous membrane between these bones. So if it were in this picture, it's not, but between the fibula and tibia here, you could find a membrane of connective tissue fibers as well, and that actually is going to be slightly movable if these bones rotate, like when your whole leg rotates. Now the Gomphoses is the last type of fibrous joint we'll talk about here. And these Gomphoses are all peg and socket joints, and they're basically where teeth fit into the alveolar sockets. So technically your teeth aren't bone, but they're held in place by a fibrous joint, and this fibrous connection is what we call the periodontal ligament, or the gomphosal fibers, and they hold the tooth in the socket. In fact, I like to talk about how, if you think about if you ever had a tooth removed, or when you're a child and you've lost your teeth, how that when the tooth is coming out, you can feel the fibers kind of ripping away from the gomphosal joint. So if you look at the structure of a Gomphosis, here's the tooth itself. Tooth is actually more similar to the nervous system and skin than bone. And so technically teeth are not bone. They're structured like bone because they're hardened, but they come from ectoderm, so they're more similar to bone. They're more similar to your nervous system and skin. Now, this is where the gum line meets the tooth. And if you look here, the root of the tooth is actually held to the bone itself, whether it's the mandible or maxilla, by these fibers right here. And so these are the gomphosal fibers. And we also have a periodontal ligament here that would hold this tooth in place. Now, because this is immovable, we would also call this a synarthrosis, because this typically shouldn't be moving a whole lot.